do something a little different this time. We've decided to take the whole afternoon, the rest of the afternoon, and focus on climate change and health. This is a bit of a longer case study session than we've done in the past, so certainly give us your feedback. We hope you enjoy it. We've decided to focus on 3 different topics related to climate change and health as sort of a jumping off point for some of the discussions. So wildfires and livestock, tick-borne diseases in wildlife, and then cyanobacteria. So to kick off the session, we've invited Dr. Craig Stephen, the Executive Director from the Canadian Wildlife Health Centre, to give us an introductory talk and to help get the discussions going. So with that, I'll turn it over to Craig.
Thank you, Erin. Hope everybody's full and satisfied and ready to go. I was one of those guys who put the hand up of who was here at the first meeting. And it's really nice to see some old friends, and it's really nice to get caught up, and everybody's saying, "So Craig, how you doing?" And my answer so far has been, I've been spending a lot of time on climate change lately. And it's depressing. The biggest challenge to public health, right, in the World Health Organization, the biggest challenge to conservation is wildlife change. There was just an interesting paper published out of UBC a while ago. Climate change is shifting evolution and causing species to disappear. One of the biggest challenges to agriculture. And as a group that's dedicated to looking at the interactions of human, animal, and environmental health, I think it's critical that climate change is something that we need to think about. So Erin asked me to try to set up this afternoon session to think about opportunities and needs for cross-sectoral action. And I've put the word action in there because we spend too long describing mechanisms of disaster and documenting demise. And we don't have the luxury of time to do that anymore. So what's the goals for the afternoon? So this process that Erin will describe to you later on, where you're going to be working together, one of the reasons to do this is to have everybody sort of share their knowledge and perspectives on how climate change and health work in BC and health of everything, whether it's the forest that we're talking about, the health of the forest for cryptococcus, the health of those porpoises, or the health of the people. We also want to increase awareness amongst everybody about the different ways that climate change can impact health. And then, this is the nice buzzword, co-learning. Learning from each other about how cross-sectoral approaches might help us to anticipate, avoid, or mitigate the impacts. So, let's just do this first. It's happening. We won't have that debate. It's interesting now, there was an editorial in the Globe and Mail a while ago that said climate change denial is no longer about whether climate change is happening. It's about whether what you're proposing to do is going to work. Oh, a carbon tax holder won't work, or this policy won't. Denial around climate change now comes around what we're doing. We're getting caught up in that. But this is just taken off out of a newspaper article that came off a ministry website that we can certainly see already measurable changes happening in British Columbia. So I want to focus a little bit on the BC Auditor General report. How many of you read that report about the government's climate change preparedness, the Auditor General's? 1. You got to pick it up if you're interested in this area. Here's some of the key outcomes. The BC government is not adequately managing the risk posed by climate change. Government has not comprehensively assessed the risk and doesn't have a plan to move forward. Adaptation needs to be better integrated into policy and decision-making processes. But on the positive side, actions are being taken at the ministry level to build a strong foundation of knowledge and develop tools. So those are some of the key conclusions out of the Auditor General's report. Went off to say that BC is failing in mitigation. We are not on line to meet our climate change targets. It's not going to happen, and there's no clear path forward on how to do that. Everybody having a good time so far? Yeah. Challenges to adaptation, right? So mitigation is we want to reduce or prevent our emissions and problems. Adaptation as well, it's going to happen. How do we cope with it? So challenges to adaptation that the Auditor General found was many departments and ministries don't have the adequate mandate, resources, or capacity to work on this. Because everybody, how many of you have a spare place on your desk that you can take another task on? Right? We don't have that capacity. There hasn't been a comprehensive assessment of the risks, so how to prioritize investment and action hasn't been there. And the Auditor General noted a real weak link to local government because most of the adaptations and mitigation are going to happen locally and even personally. So the red and blue things are what the Auditor General said are the big issues to think about in British Columbia. Now, this wasn't just a health assessment, it was just in general. Highlighted flood, wildfires, and drought. It's interesting, I was at a meeting that Interior Health sponsored a few weeks ago. I don't think anybody else was there. Was somebody else there at that meeting? And interesting, up there, of course, it's wildfires. Wildfires were, whereas the people from Island Health were saying, from VHA, were saying, actually, droughts are a big concern. So it differs across the country. The other two of invasive species and shifting ecosystems were the top five, the other two of the top five the Auditor General pointed out to you. When you read the document and we think about health, though the Auditor General might not always say it, they kind of grouped it into certain ways. So for people, the focus were on things like safety, fires, heat, stuff like that, communities, economies, and illness, some on illness. Environments, a lot of focus on forests, lands, and streams, what's going to happen with them. Agriculture, didn't really talk at all about diseases, but the impact of the land and water security, and in animals, there's a big emphasis on wildlife and fish within the document. So, that's what the Auditor General said. Now it's my time to, what the hell you said? Pontificate? Thank you. So some things to ponder as we go forward. We're not going to guess what's going to happen. The interactions between climate, society, and environments are going to cause unpredictable outcomes. So that gap between what we think is going to happen and what actually happened is going to grow bigger as the changes get more extreme. Even if we just think about a complex ecosystem, a social ecological system, complexity theory tells you you can't predict because surprising things happen. So we're unlikely to predict something enough to evoke action. It was interesting at this meeting in Kelowna, everybody said, well, let's tie climate change to human health. That'll make people do something. I said, well, we still smoke. We still drive cars. We still do, what doesn't kill you nowadays, right? All of you who are probably over 50 felt guilty eating the desserts today, whereas those of you who are under 50 probably thought no problem about it. You made it changes over time. Everything's bad for us eventually. So to say one more thing's going to kill you is unlikely to evoke change, and especially if we don't predict it. That was one of the problems we had with the emergent disease world, right? We're all going to die of pandemic flu. Oh, well, we haven't? I'm not worried about that anymore. Because humans have what I call apocalyptic attention deficit disorder. Right? We habituate to problems. So what we need to figure is how do we inspire a shared path forward? And when we look at other initiatives about collaborative actions, one way we can do this is do what I call collective intelligence. Cognition, cooperation, and coordination. We have to start seeing the same picture, cognition. Let's have some situational awareness, sharing information. What are we seeing? What are the signs? What are the signals? And how do we work together to sort of pull that together to do some sort of forecasting? Cooperation, you can't do that without a trusted network. This meeting came from a grant that I had in, well, whatever it was, almost 20 years ago now. At that first meeting, wildlife people sat there, public health people sat there, ag sat there, and there was what, a couple dozen of us? Now, look, people are starting to know each other and starting to trust each other. Developing that ongoing trust to be willing to share information is hugely important and not have to hoard it for our own selves. And finding ways to share information, whether it's through the telephone or other ways. And then coordination. You saw the Auditor General said you don't have the capacity to do this all on your own. Right? We've got to find ways where we know, you know what, actually that's important for the salmon, that's important for the community, and that's important for agriculture. We have a shared interest to work on. So we need to get better at collective intelligence. And a lot of that path through shared path comes from way back to the Millennial Ecosystem Assessment, which showed us the interdependency of a healthy ecosystem and healthy society. Historically, we've always treated the environment as a source of harm. If you look at the National Collaborating Center for Environmental Health's website, it's all the dangers the environment poses to you. But the environment actually produces what we need to stay healthy. It gives us the opportunity, the options to do something in an unpredictable future. And so we know there's this codependence between the health of the environment and our health, and we know that there's a codependence between our decisions for healthiness and the well-being of the environment. So we have that shared pathway that was set up in the Millennium Ecosystem Assessment a long time ago. My predictions. You are going to get money, whether it's for animal health or human health, for acute nasties. Heat, deaths due to heat, respiratory disease, vector-borne disease, things like that. And who cares? Right? I mean, you care if you die from it. But a couple of dozen more deaths from heat, or a couple of dozen more deaths, or a couple of thousand more Lyme disease cases are going to pale between the impact of climate change on the determinants of health. So I always look back to when cod disappeared. There are some of you, every year there's more of you who aren't that old. Right? Remember cod disappeared in Canada? East Coast, right. So we overfished them. What happened to the communities where cod disappeared? Well, there's no income. When there's no income, there's no ability to support the schools and the doctors. People start moving out. They lose access to health care. They don't have money to buy the stuff they need. Increase in alcoholism, increase in family abuse, increase occupational injury because they had to fish further for crab, increase mental health problems, right? The impact through these social determinants of health are going to have much bigger effects on society as well as on wildlife and agriculture, because those changes to wildlife and fisheries aren't going to come from a new pathogen. It's going to become because the Fraser River warms up fast, the salmon come down earlier, and their food in the estuary is not there. Birds are going to migrate up earlier because of change, and the insects haven't emerged for them to eat. We're seeing those sort of things already. So although the death, disease, and destruction is going to be sexier, and it's going to be what you're probably going to be pressured, we actually have to sit and ask what is affecting the health and sustainability of these communities rather than the death, disease, and deformity that we see today. So we need to start shifting to thinking a little bit more about vulnerability and resilience, and how do we strategically focus on those subpopulations where we can act. So for some of them, right, number one in the middle, that are exposed, sensitive, and have low capacity to adapt, they're at the greatest risk. We need to do something right away to intervene. For ones that are exposed and sensitive but have a good adaptive capacity, we've got to start to think about, well, how do we make sure we bolster their adaptive capacity so they can deal with this? For ones that aren't exposed, how do we keep the exposure? So anyways, you work through these things to think, it's not going to be a generic approach. It's going to be a customized approach to climate change where we try to get ahead of the game. If we wait for the disease, if we wait for the deaths, we will always be too late. Right? So we have to be focusing, in my view, to developing health and resilience rather than innovative ways to find death, disease, and destruction. Now, clearly it's not an either or. It's a continuum. My advocacy today is to make sure we can provide the continuum of care rather than investing only in the terminal events. One of the biggest challenges around climate change that we have to deal with is this. This is something that we don't talk about a lot. It's what I call the well-being paradox. When my son went down in high school to a poor community in the Caribbean to help, build a pharmacy, and he came back. He'd never really seen poverty, real poverty before. And he says, "Dad, I get it." I said, "What do you mean?" He said, "If my kid was hungry, I'd kill the last of an endangered species to feed him." Absolutely. We know that you care about the well-being of the environment only after you reach a certain socioeconomic status. So when you look at this graph, all the ones at the top have a high socioeconomic status. But we know to have a high socioeconomic status, you have a massive ecological footprint. Right? The only sustainable countries that are down here in the one are very poor countries. All of our development strategies to make people better off increase our environmental footprint. So in order to get them well enough to care about the environment, we have to screw the environment. This is a massive paradox that if we do not deal with that, and we compete with public health wanting to say, but I did public health for years. The reason I went back to the Wildlife Health Cooperative is I went around the world recognizing that if we don't provide the resources for future, we're screwed, right? I don't need to save more people. We're growing exponentially, right? And so how do we make sure we can look after well-being in a way that provides for intergenerational and interspecies health equity? In other words, creating the well-being of one generation and one species doesn't decrease it for another. That's going to be our biggest climate change challenge. So I'm starting to look at fossil fuels like I look at heroin. Not personally, right? How do we adapt the harm reduction approach? We're addicted to fossil fuels, but I'm not going to get rid of it. I want to be able to do something today. I'm not going to do a scientific study that tells me the exact right thing. I'm not going to convince people with data. Harm reduction is about working within scientific uncertainty and social conflict to work together on shared values. What can we do to reduce exposures and susceptibilities? What can we do to increase coping capacity and deal with harms as a cumulative effect? So, as I said, we need to expand this concept of health equity from just about our health and equity within our communities to health of, I say, I've got a grandkid now. Who's looking after his health 80 years from now? Or his child's health. So we need intergenerational health equity, and we realize we can't do that at the expense of the environment, so we need interspecies. So we want them to have all species across multiple generations can reach their full health potential. They should not be disadvantaged from attaining it because of climate change. And we want the fair and equitable distribution of resources needed for health and sustainability to balance the needs of today with the needs of tomorrow by investing in and maintaining both the social and ecological services that society and the environment provide us. So that's pontification over. That's just my challenge to you to think beyond, we should do something about Lyme disease as our BC strategy. To think about actually creating healthy social and ecological systems that can resist whatever life's going to throw at us. So today we have 3 case studies. Aaron mentioned it was wildfires, cyanobacteria, and vector-borne issues. And to prime your thinking when you go around that, you're going to hear from each of them now. They're going to introduce the cases. Then Aaron will tell you how you're going to assemble the talk. We want to start thinking about what could be the scope of practice of an intersectoral climate change adaptation program in the province. How will we tell the Auditor General, which is Ron next time, which comes around and says you're not doing things together? And so what are some of the roles, options, and opportunities to implement action? And in each case, you're going to go around to the tables, and you're going to, A, try to understand the issue better by asking questions, but we want you also to provide insights and advice from your realm. Maybe you've never done anything with wildfires, but you've done something around, we did the salamander risk assessment. What do we learn about that? What are we learning from the aquatic side that you might say, well, here's something that we could learn about and share advice, so we can start to think about how could we inform a plan forward for collaborative and collective action, and most importantly, what to do after this meeting. In the last climate change meeting I at, they gave you the 24 challenge. What are you going to do in the next 24 hours about climate change? What are you going to do in the next 24 days? And what are you going to do in the next 24 months? And if you have that in the back of our mind as we go forward, we might have a plan of action when we leave the meeting. So with that, Aaron, I'll let you introduce the cases. Thank you.